This is my husband, Jeremy. We met back in 2003 here in Charlottesville. We married a year later. 2 years ago, he went on dialysis. He needed a kidney, and through some wonderful modern medicine at UVA, I was actually able to be a donor. So we are actually now, I guess, even closer than spouses at this point.
Make for a difficult divorce.
Absolutely.
You don't automatically get Veterans Administration benefits simply because you were active duty or spent some time in a combat zone. Only if the VA approves you for something service connected, or it can be connected to your active duty status, only then will they normally approve Veterans Administration benefits. So not all veterans get those simply by virtue of being a veteran.
One of the qualifications in this country, if you're going to be a recipient of an organ, is you have to financially be able to support the medication that it will cost to keep you alive on that organ. As far as having a kidney is concerned, that's $50,000 a year. If you don't have health insurance, that's how much it costs. So if you don't have proof of health insurance, you're not a viable candidate to be a recipient, because you're not going to live if you don't have the money to support the medication. To me, that's not equal, in terms of who gets, it's a have and have not situation. The people who have health insurance or coverage or the means to pay for it are the ones who get on the list and get to move to the top. And I think that's crazy.
My kidney started failing in 2003. At that point, I was under VA care due to a knee issue I had during Desert Storm. And so they covered me for the most part there. And then when it come time to do the transplant, my wife had wonderful health insurance, so we went to the UVA hospital here for the actual transplant itself. This was in late 2007. In late 2008, both of us lost our jobs, failing economy. And she went an extended amount of time without health insurance, which means that it's more difficult to get health insurance after you've gone extended time without it.
I am considered to be a pre-existing condition as an organ donor. Yep. On top of that, so even though my health insurance kicked in, I had a pre-existing clause for the first year of my employment after the 90 days. So I will not be eligible to have medication that I need covered until I've been at my job for 18 months, which will be another 6 months from now.
But I realize I'm one of the few lucky cases there. It could have easily been, I would have been stuck. Didn't know what to do. Luckily, I'm covered by the VA as a disabled vet, so I had some help there too. But where do poor people go? What do they do when they need that help? They go to the emergency room. They don't get treatment, which ends up costing taxpayers more than if we just covered them to begin with.
It's a complicated issue, and public option, I think, is the best of all the choices that are on the board. My personal viewpoint, I think universal health care is the way to go. But as far as getting something done now, I don't think that we really can afford to have 40,000 people a year die for lack of coverage while we get something perfect. Something needs to be done now. Obviously, I think one of the highest priorities needs to be dropping the pre-existing condition clause so people who need it can get help. And, it's kind of crazy. They talk about, the insurers talk about, well, that's really going to raise, costs for everyone. I'm a very healthy individual. If I wasn't healthy, they wouldn't have let me donate a kidney, okay? But that's considered a pre-existing clause. I think there are a lot more people out there that are basically have nothing particularly wrong with them, but they just need basic health care, maybe some medications, and they're being denied because the healthcare companies don't want to have that in their risk pool. And it's absurd to have corporations running our healthcare system the way it is. I mean, there's no benefit there to us as Americans. It's a fixed system, and nobody's winning except for the corporations that are basically getting the payouts. Now, in terms of mandates, that's a hot topic, and I can understand why. But I also understand the economics. If you have coverage pool for everybody, that means everybody has to pay into it, whether you're healthy or sick. So we need to get something done. It's costing American lives.